Good morning, everybody. My topic for today is critical incidents reporting. To begin with, what is critical incidents? It is a healthcare incident or adverse event which is an unfavorable event that harms a patient, a caregiver, or any other individual, or has a potential to harm them. It can be a medical error, it can be patient injury, it can be equipment failure. Critical incidents don't only happen in healthcare industry, they also happen in factories, companies, where a chemical spill can harm somebody and it is a critical incident. Also in railways, a signaling error can cause a devastating railway accident, which is also an incident. There are many terms and types of critical incidences. We'll just go through some. Error is the failure of a planned action to be completed as intended or a use of a wrong plan to achieve an aim. Error can be error of execution or error of planning. Diagnostic error is an error or delay in diagnosis, failure to employ indicated test or therapy, or failure to act on the result of monitoring or testing. An adverse event is defined as an event that results in unintended harm to the patient by act of omission or commission. Act of omission is failing to do the right thing, whereas act of commission is doing a wrong thing. And we have to remember that act of omission, that is failing to do the right thing, is doubly responsible than the act of commission. It is not an injury or complication of a disease particularly, it is an injury related to the medical management. Adverse events may be preventable or non-preventable. Preventable adverse events would be equipment failure or system failures. There is a very important entity called near miss or close call, which is a serious error or mishap that has potential to cause an adverse event but fails to do so because of chance or because it was intercepted. It is also called as potential adverse event. Statistics say that one out of every 50 near miss events or incidents are reported, whereas the ratio is likely to be lower as more of near miss events are handled and managed well, and they're easily forgotten and people move on. But we have to remember that a near miss which is not reported is a next accident. People must come to know that there was an event which could have happened. There are other terms like sentinel event, which is an unexpected occurrence involving death or serious physical or psychological injury. There is workplace incidences like physical abuse to doctors and needle prick injuries in healthcare industry. Non-clinical incidents like documentation errors, and hazards, which are any kind of threat to the safety like unsafe practices, equipments, labels, etc. What is the incidence of critical incidents? The total incidence of critical incidents ranges between 0.2 to 9. In some studies, they have even reported 16%. It also depends on what all you really include in the critical incidences. Every year in NHS, about 9 lakh incidences are reported and 2,000 of which result in death. Globally, they say that as many as 4 out of 10 patients are harmed in primary and ambulatory care settings while receiving healthcare, and up to 80% of the harm is preventable. But overall globally, only 1 per 100 errors are reported. That low is a reporting at first place. There is a study conducted in Ukraine. It's a multi-center study where they studied the critical incidences during anesthesia, which was a prospective audit. And they asked clinicians to fill the forms anonymously and voluntary submissions. And they found out that the critical incidence was 9.35 cases per 1,000 anesthetic procedures, and 45% of these patients were ASA grade 2 patients. Also in the study, they found out that 44% cases were preventable, and 18% cases the consequences could be minimized. So what is critical incidence reporting? It is a system developed to acknowledge any such unfavorable event and duly notifying it to the in a formed way to the respective authorities to bring out necessary changes, aiming higher patient safety and better work environment. Let's see how the critical incident system reports works in various countries. In UK, there is a National Patient Safety Agency which has incorporated 2 systems, which is incidence reporting system and reporting and learning system. In USA, there is a report of medication error and adverse events, which is a confidential reporting system, which is Mark's SM system. Then there is a Sentinel event reporting system by Joint Commission Accreditation of Hospitals, and there is a National Confidential Medication Error System, which is an Institute of Safe Medication Practices. In Australia, they also have dedicated critical incidents reporting system sponsored by Australian Patient Safety Foundation. In Japan, Council of Quality Healthcare voluntarily reports the adverse events. Denmark and Netherlands also have dedicated reporting systems. Now the question is, do we have critical incident system for India? And the answer sadly is no. We do not have any national system developed for critical incidents reporting. We do have hospitals privately doing their own critical incidents reporting, but data mostly stays within the hospitals and it is not communicated outside. There is a study conducted by Dr. Gupta and her team in India, that is critical incidents reporting in anesthesia. It was a prospective internal audit. They found the critical incidence was 0.79%. It being a prospective study, it avoids an inaccurate recall of the events happened, and also the warning about any incidences can be issued soon after the incidences happen. But again, this was an internal audit, so there was a limited accessibility for others to learn from it. It was subjective reporting, so it is unfair in terms of comparison between other hospitals and carries an acknowledged biases. Also, this is the need that we need to come up with a standardized reporting system so that we can develop a national database. There are types of reporting systems. So one is a learning system, which solicits the report from caregivers or organizations. In that, the focus system, which targets a specific areas like medication error, these solicit report from specialists such as pharmacists. And broad-based system of reporting, which looks to organizations and caregivers, but usually it accepts reports from anyone, even from the patients. There is another type, that is accountability system, which is based on the notion that the government has a fiduciary responsibility to ensure that the healthcare organization take necessary precautions to ensure that the care is safe. Based on the reporting style, there is a pro forma based reporting. So it is a closed question narrative. It's like a tick mark kind of a form that you have to fill in. And there is another type, which is narrative based reporting, whereas you can actually write a little more about the event, like in a essay kind of a way. And there is voluntary or mandatory or both reporting. So how does the reporting function? It has 4 phases. First is a data input, where you encourage the person to report, giving an opportunity for anonymous or voluntary reporting and in non-punitive manner. So people can report without being fearful about legal actions. The second phase is the data, the way in which the information is gathered and handled. So if you have a narrative-based reporting system, you can give them an opportunity to freely express how the incidents happened. The chronology can be well understood and the factors contributing can also be mentioned. The third important phase is analysis, where the basically only reporting will not improve patient safety. Neither the act of reporting nor the data collection will accomplish an objective when it is not analyzed and the recommendations are made on the basis of analysis. So analysis is very important. The fourth phase is feedback or action. The goal of feedback must be to learn from the mistake and to ensure that the systems are improved for better patient safety in future. Blame and defensiveness shouldn't be the part of this feedback action. What is a purpose of incidents reporting? It gives us an opportunity to find the root cause of that event. It helps us in discussing it with seniors and experts about those unsafe situations. That can give us an opportunity to policy redesigning and process improvements. We can assess the risk better way if we have reporting. For example, if you know that there have been more of critical incidences happening in ASA grade 3 patients, so you can include more of experts of that field to manage those patients clinically. It gives us an opportunity for continuous quality improvement, which is an evidence-based practice. So if we know that there is, by reporting and analysis, we know that there is a better way to do something, we should be doing it. It gives us an opportunity for better training and learning, and even we can timely manage our problems and avoid rescheduling, and we can have a better organized working systems. We have to learn from the mistakes of others, because you cannot live long enough to make all yourself. And we have been learning socially like that. Patient safety is everybody's business, not only by working harder towards it, but also by learning from our mistakes. There is very important thing that which is a reporting culture. Professor Donaldson, who's a WHO envoy for patient safety, has said that to err is a human, to cover up is unforgivable, but to fail to learn is inexcusable. But many times we come to find that to err is a human, which is acceptable, but to forgive is against the company policy. We are fearful that there will be some legal action taken against us, or somebody is going to blame us. We very fondly compare our healthcare industry or anesthesia industry with aviation industry, but reporting critical incidences in aviation industry and health industry is different. There is a very fundamental different approach to critical incidents reporting in both the industries. In aviation industry, it is a blame shame free environment about reporting. They maintain the confidentiality whenever it is necessary, and failure to report any critical incidents is rather taken seriously. It is considered an worthy act. So when there is an appraisal, there is a point to be noted that this person had reported anything that was gone wrong, or he made any mistake and he had reported. It also helps in organizational transparency, which eventually leads to good reputation of an organization. And it in aviation industry, there is a degree of immunity against the disciplinary action if any of the disciplinary action is taken. So what are the barriers in reporting? Worry over the legal ramification. And this was a major problem found out with the clinicians reporting less of critical incidences. In the studies, they found that the doctors mainly don't really report any critical incidences because of the legal ramification worries. Blame and shame culture, guilt and fear of punishment, uncertainty about wrong and right, lack of trust in confidentiality and follow-up, lack of encouragement for reporting. In one of the studies, they found that the 40% doctors did not complete their incidence reporting, even if they tried, but they didn't make a complete incidence reporting. Another study found that the doctors do not report because of unfamiliarity with the process. Blame or legal action and discrimination at the workplace is another major concern about doctors not reporting. Also, it gives an impression that only bad doctors make mistakes, or if you make a mistake, you will be called as a bad doctor. Lack of time is a major concern. No easy reporting system or paper-based reporting system. The barriers, under-reporting. Like I said, the doctors did not complete their incidence report, and so better analysis cannot be done unless there is a complete reporting. Delayed reporting, where you lose a chronology of an event, there can be inaccurate recall of the event. And gradual formation of incidents like a hospital acquired pneumonia or DVT, which happens over the days. So in those kind of situations, the reporting is not done properly. What is needed for critical incidents reporting? A simplified reporting, like a simple pro forma, which is easily accessible for everybody. It should be done in real time or earliest possible, so that all the events are recalled properly. Reporting should be better if it is from the first responder. It does not mean that the other people who are standing by cannot report an incident, or they should not report an incident. Any report should have a contribution from all the people involved in the scenario. There should be confidentiality about reporting, or voluntary. In case of voluntary reporting, obviously, like, it cannot be made compulsory, but you should encourage people to report. And there should be a system for analysis and follow-up. Factors that contribute to successful error reporting: flexible and learning culture, acceptance of human fallibility, which establishes the trust and satisfactory feeling about the reporter. Being a trustworthy, willing to report, willing for improvement, and reliable for the task allotment. Training on safety issues, confidentiality, anonymity, and voluntariness. Implementing necessary changes and feedback, which is very important. Unless the person who has reported sees any changes that are being made, or at least a feedback given to him that his reporting was noted and they are making an analysis of it, unlikely the second time he will report. There should be a support, trust, and leadership in the reporting system. Annual appraisal should make a note of critical incidences and degree of immunity if the punitive action is taken. What is the information that is required on the critical incidents reporting form? It should include patient's name, hospital number, date of birth, date and time of incidence, location of an incidence, brief factual description of an incidence, name and contact detail of any witnesses. If there was any harm caused, it should be mentioned there, and action taken at that time to correct the situation or harm, and name and contact detail of the person reporting an incident. There are two articles by WHO, which is one is a WHO draft guidelines for adverse event reporting and learning system, and second is a patient safety incidents reporting and learning system. These both are available on internet. These are booklets actually. They refer to two major reports which were published nearly 20 years back, which drew attention to importance and severity of problems, comparing it with parallel risk industries, and realized the weakness in health sector about lacking in incidence reporting. One of the article is "To Err is a Human," where they've said that one of the greatest contributors to accidents in any industry, including healthcare, is a human error. However, saying that an incidence is due to human error is not the same as assigning blame, because the most human errors are induced by system failures. Humans commit errors for variety of known and complicated reasons. So if we know the reasons behind those human errors or any factors contributing to that, and if we know the preventability by reporting such incidents, then we can certainly work towards patient safety. The another article is "An Organization with a Memory," where NHS noted down the failures and examined them, and they realized that how NHS might learn from those failures and recommend methods to minimize the future failures. Also, they wanted to create a unified reporting mechanism, support an open learning culture, and ensure that the lessons learned are applied and the changes are made, and more broadly embrace the system approach to minimize such errors. Hukami and his team studied the significance of incidence report by medical doctors for organizational transparency and driving force for patient safety and the quality improvement in healthcare, where they realized that any effort to improve incidence reporting and learning from it should begin with actually the clinicians believing in the fact that their reporting will not get lost somewhere, but rather it will be analyzed in a non-punitive way and systematically analyzed, and which will result in an action which will ultimately improve patient safety. So unless you keep the clinicians in the loop, they will not be encouraged to report critical incidences, and worldwide even now the critical incidences by clinicians is less, probably for the same reasons. Also, it is impossible to prevent errors completely, but it is possible to put in place procedures which can act as a barrier in making mistakes. So for example, it's like checklist, which is a simple way to doing that. Also, we have to understand that many problems are new and never happened before, so or they can have a different presentation. So it is important to report all the errors, mistakes, and the near misses. There is a quote saying there is only one thing more painful than learning from experience, and that is not learning from experience. So it is important that we accept our mistakes and try to learn from it. These are two critical incidents reporting forms. On the right side of the screen, there is a closed question type of a tick mark type of a form that includes critical incidences, and you can mark on that. And the other one is a more of a narrative type of a form. Interestingly, in a narrative type of a form, they have also given a space to write what factors you think could have prevented these events. So this kind of critical incidents gives a very free expression of incidents, and also can have input from the clinician who have faced it first. So this is how the critical incidences can be reported, and we can actually learn from all the data that is collected. There is another quote which says, people typically feel bad about their mistakes because they are short-sighted about the bad outcome and not about the evolutionary process of which mistakes are an integral part. Every mistake that you make and learn from will save you thousands of similar future mistakes. Thank you.